Hello and welcome to our presentation.
My name's Angie.
My name's Eric.
My name is Rebecca, and for our project, we chose Autism Awareness and Acceptance.
The formal definition of autism, better known as autism spectrum disorder, ASD, is properly known as a neurological and development disorder that has a wide range of symptoms that can start appearances as early as 2 years old and can be diagnosed even later as 28 to 30. Its wide range of symptoms include social and communication behavioral issues, intellectual disabilities, and other physical or mental health conditions. It is considered a spectrum primarily due to the fact that it is a wide range of symptoms that are not set specifically to an individual's and can be also hidden symptoms as well.
Related laws that support individuals with autism is an IDA, which started in 2004, that ensures that students with disability, including autism, receive a free, appropriate public education in the least restricted environment. The next one provides individualized education programs, IEPs, that are tailored to meet the unique needs of students with autism spectrum disorder. Autism is listed explicitly as one of the 13 disability categories underneath the IDA. Section 504 of the Rehabilitation Act of 1973 helps students with autism who do not qualify under IDA, but they may still receive accommodations through a 504 plan. They get extended time, sensory breaks, or visual supports. It protects the rights of individuals with disabilities in programs and activities that receive federal funding, including public schools. There's also an Americans with Disability Act, ADA, which started in 1990 and was updated in 2008. It's a civil rights law that forbids discrimination against individuals with disability in all areas of public life, including jobs, schools, transportation, and public-private places open to the general public. And it ensures responsible accommodations in the workplace and access to community resources. Understanding the needs of students with autism. Students with autism spectrum disorder have a wide range of physical, social, emotional, and health-related needs that can impact their learning and daily experiences. Many experience sensory sensitivities from loud noises, bright lights, or certain textures can feel overwhelming. Motor coordination challenges are also common and can affect tasks like handwriting, balance, or participation in physical activities. Additionally, there can also be health conditions such as sleep disturbances, seizure may disrupt learning and daily routines. Socially, students with ASD might struggle to read cues, maintain eye contact, or build friendships, not because they don't want to connect, but because those interactions could be difficult to interpret. Emotionally, they may find transitions or unexpected changes especially distressful, which can make emotional regulation more difficult. Still, these challenges are not roadblocks to success. Instead, they are opportunities to offer thankful, supportive strategies that can foster growth, inclusion, and a sense of belonging for every learner. How do we support ASD needs? There's 3 ways to support students with autism in the classroom. Make the environment sensory friendly and flexible. A lot of students have sensory needs, so try to create a space that feels safe and calm. Keep noise levels down with headphones. Use softer lighting when you can, and set up a quiet area where students can go if they need a break. Also offer choices. Some kids hate the feel of crayons and markers, so let them use a stylus, type, or draw instead. It's all about giving them options that feel comfortable. Be intentionally with social supports. Social interactions can be tough for students with autism, but that doesn't mean they don't want to connect. Treat social skills like we do academics. We model, we practice, we walk it through. Might do a quick role play on how to ask a friend to play, or we might work as a class on noticing when someone needs space. Also, pair students carefully because one kind and patient buddy can go a long way. Build emotional safety and structure. Transitions and changes can feel overwhelming, so use visual cues and give students head up warnings before anything. A calm down have a calm down kits ready, and use tools like stories to help prep students for situations that might be hard. And I've learned that my class my classmate matters. If I stay grounded and study, it helps them feel safe too. Free community resources support autism. Southwest Autism Research and Resource Center, SARRC, offers intervention, diagnostic services, and social programs for all ages. They also provide training for educators and families, helping everyone feel more prepared and connected. Raising Special Kids is a nonprofit that offers free support to families navigating disability services. They help with IEPs, hold parent trainings, and provide peer support. What makes them stand out is that many staff are parents of children with disabilities, so the help feels real and reflectable. Autism Society of America is a national organization that has local chapters and focuses on advocacy, public education, and support. They offer webinars, resources for school and home, and connections to community events and services.
Community resources that support families and students with autism. Families of children with autism spectrum disorder benefit greatly from strong community support systems. These resources offer services like early intervention, therapy, education, advocacy, and opportunities for connection. Access to the right support can help families navigate challenges, celebrate programs or progress, and build network of care. Arizona Department of Economic Security, Division of Developmental Disabilities. The DDD offers services to eligible individuals with autism, including support coordination, therapies, and early intervention. These services can help families manage daily needs and long term planning. Arizona Department of Education, Exceptional Student Services. ESS provides guidance to schools and families on special education services. They offer resources, training, and support to ensure students with autism receive an appropriate education under IDEA. Autism Society of Greater Phoenix. This nonprofit provides support groups, parent workshops, events, and advocacy efforts for individuals with autism and their families. Their programs help build community and empower families with knowledge and connection. How to promote inclusion to children with autism. Implementing UDL. A universal design for learning is a framework that helps teachers and educators design lesson plans and various formats for presenting information to all students, including those with autism. This allows for students to have equal opportunity with being successful in their learning, and this can be demonstrated by using hands-on activities or songs to enhance student learning and keep them engaged and motivated in the classroom. Peer support and social skill programs. Peer support is important for promoting inclusion, especially when it comes to students with autism. Many students that have autism often struggle with social skills. By creating a buddy system and pairing classmates who can help them during class and break times promotes students to learn social skills and inevitably helps them when working with groups. Social skill programs are activities that help students, like students with autism, learn how to participate in social situations. This can help them feel more included in class by helping raise their confidence. Provide and offer professional development for teachers. Schools and districts can help educators become more inclusive in their teaching practices with children who have autism in the general education setting by providing them with learning opportunities to develop better communication skills and teaching approaches through their teaching workshops. These learning opportunities would allow teachers to learn new approaches in their teaching styles for their classroom to be more effective for students with autism. These workshops can also include educating teachers on how autism can be presented differently for each student and also find ways to manage sensory overload, as this is something that many children with autism deal with. School systems that are continuously educating their teachers can create a more effective learning environment for students with autism. Resources for strategies to meet the needs of individuals with autism. Autism Speaks School Community Toolkit. This resource offers not only educators but also parents and caregivers tools to help children with autism thrive academically. By understanding how to support these children and having parents know how to better advocate for their child, it will be more effectively placed to support them in the classroom setting. Some of these strategies that the resource covers is classroom accommodation, such as visuals, flexible seating, safe spaces for emotional regulation, and modification of classwork. Also, teaching for communication or techniques for communication, which is using clear language, social stories, and visuals. Behavioral support, such as skill trackers and behavioral charts, and keeping consistency of expectations. Inclusive classroom strategies, peer buddies, UDLs, flexible routines such as brain breaks and opportunities for movement. CAST, Center for Applied Special Technology. This resource focuses on the implementation of UDL. This framework is designed to create a flexible learning environment that can accommodate all learners, including those with autism. It provides diverse learning strategies such as multiple means of engagement, like using interest or sensory to keep students engaged, representation by presenting materials in various formats, and expression by providing multiple ways for students to show their knowledge. Autism-focused intervention resources and modules. This resource provides evidence-based practices for autism and also provides easy-to-follow videos that target the core challenges that children with autism face and how to meet their needs. These things include struggling with communication, social interactions, and sensory sensitivities. This resource also provides strategies to help support their needs, such as visual supports, prompting, social narratives, video modeling, and reinforcement.
To better understand autism or ASD, down below we have a great resource video created by Recess Medicine that will clearly explain the ASD disorder, what symptoms that they will experience, diagnostic statistics, and how to better understand our fellow community members that suffer from this disability.
This video will look at autism spectrum disorder. You'll find free practice material, including multiple choice questions, flashcards, and case scenarios available through Wizdolia that gives you feedback as you answer on what you got wrong and why. Find the link to the autism set below. Autism spectrum disorder, or ASD, is a neurodevelopmental condition classically characterized by social interaction and communication difficulties with restrictive, repetitive behaviors and interests. As the name suggests, a spectrum of different presentations is possible, ranging from severe disability all the way to cognitive strengths. This is important because historically, the term Asperger's syndrome was used to describe those with higher functioning or higher IQ, but is now considered part of ASD, as are other neurodevelopmental conditions like childhood disintegrative disorder. And it's worth noting, ASD is now becoming increasingly seen as an example of neurological and cognitive variation between people. As we mentioned, the clinical presentation can vary greatly, but the two core domains affected are social communication and interaction, and repetitive, restricted, or stereotyped behaviours, interests, or activities. In children, the manifestations depend on the age as well as the domain involved, with over 80% of affected children displaying signs of ASD before 24 months. Example symptoms affecting social communication and interaction include delayed nodding or shaking of the head, a lack of vocalization or babbling, or delayed language, some of which may be non-verbal, while others may have early language development and have adult-like speech. There's often fewer facial expressions, And one of the most sensitive markers is not pointing at objects of interest, instead touching or guiding the caregiver's hand to it. This may be because of what's termed mind blindness, or a lack of theory of mind, where people with ASD are not able to imagine what another is thinking, and so the child cannot imagine that someone else would understand what was being indicated by pointing. Examples of restricted stereotyped behaviour include repetitive movements like flapping, becoming distressed beyond expected with a change in environment, or extreme under or overreaction to sensory inputs. Another is not playing games like peekaboo or not playing with other children. Regression of language before 3 years of age is also considered a red flag for possible ASD, and regression above this age would warrant investigation for an alternative cause. In older children or adolescents, manifestations can include frustration making their feelings known, often with emotional outbursts, restricted and ritualistic approaches to eating and drinking, and difficulties forming friendships. In adults, ASD should be considered if there are one or more of social communication or interaction difficulties, stereotyped restricted behaviour, or resistance to change or restricted interests that have an onset in childhood, and one of difficulty in finding and keeping employment or education, previous contact with mental health or learning disability services, and difficulty in initiating or sustaining social relationships. Often, adults with ASD will present during times of stress in their lives. Overall, over time, people will often learn to mask their ASD, especially females, and of the people with ASD, 40 to 80% will have an intellectual disability, and often there is an uneven cognitive profile, where people are relatively stronger or weaker in different cognitive tasks. Roughly 20 to 30% will also have epilepsy. The exact pathophysiology is not currently known, but it is thought that ASD is the result of a combination of factors, one of which being genetic influence, with 50 to 80% heritability, which is the proportion of the variation that can be attributed to genetic factors. However, most children with ASD do not have an affected relative. Around 10% are linked with genetic syndromes, like Fragile X syndrome, tuberous sclerosis, or Down syndrome. Prevalence is estimated to be 1 to 2%, with it being around 4 times more common in males than in females. However, it's considered underreported in females, possibly due to differences in presentation and severity, but also because screening tools may be less accurate in females. Other risk factors include sodium valproate exposure during pregnancy that appears to be dose-related, increased maternal and paternal parental ages, and prematurity. In the past, it was thought that vaccines may have caused ASD. However, current evidence states that this is not the case. A diagnosis is typically made by a specialist and is clinical, meaning it is based on the history and examination rather than any specific test. There are some standardized interviews and observational assessment tools that may be used as part of this. For example, in adults, the Autism Diagnostic Observation Schedule and the Autism Diagnostic Interview Revised. ASD screening tests are also available, but should not be used alone as a tool to decide whether specialist referral is needed or not. For example, the Childhood Autism Rating Scale. Many of these tools are based on the DSM-5 criteria, which require persistent deficits in social communication and interaction across multiple contexts, including all 3 of deficits in social reciprocity, in non-verbal behaviours used for social interaction, and deficits in developing relationships. There must be restricted, repetitive patterns of behaviour, interests or activities, with at least 2 of stereotyped or repetitive motor movements, inflexible adherence to routines or an insistence on sameness, restricted fixated interests with abnormal intensity of focus, or hyper or hypo reactivity to sensory input. These must be present in the early developmental period, cause clinically significant impairment, and cannot be better explained by intellectual disability or global developmental delay. Children with social or communication difficulties should receive a hearing test, and a full neurological examination with measurement of head circumference is also done, as there is an association between macrocephaly and ASD. As we mentioned, conditions like Fragile X and tuberous sclerosis commonly feature ASD, so children with ASD and intellectual disability or dysmorphism may undergo further genetic testing. Treatment and management involves maximizing the function and quality of life of the individual and supporting their families or carers. Management is generally delivered through a multidisciplinary approach, and also often included are the parents or caregivers. It's important to remember that the needs can vary greatly between individuals, but also can change within that individual over time. Applied behavioral analysis is an approach where behavior is analyzed and subsequently matched with appropriate strategies tailored to suit that individual. This approach involves teaching skills with small, progressive changes over time, including in cognition, communication, self-care, and even employment support. Speech and language therapy is also frequently used and can feature a range of communication methods, including speech, pictures, and speech-generating devices. In some cases, physiotherapy and occupational therapy are useful, particularly in those who have deficits in motor function, planning, or sensory processing. Pharmacological therapy is not typically used for core features of ASD, but in cases where there is no response to behavioral techniques, antipsychotics like risperidone or aripiprazole may be used, and associated disorders like depression, anxiety, OCD, and insomnia may benefit from pharmacotherapy, usually alongside cognitive behavioral therapy. Dietary modification has not been found to produce a significant benefit.
Comprehensive questions. To better understand our ways of teaching and learning what ASD is, please follow these questions and think about how you can improve your inclusion in this. First, in what ways can we better the teaching environment for these students utilizing UDLs to better accommodate the social and emotional needs of the students with autism? What assistive technologies could you use to aid with physical needs such as sensory and motor conditions that would benefit students? Finally, what methods of teaching would you highlight as instructions for parents to utilize at home with their student to continue their development in a loving and safe environment at home? Down below, we have a vast selection of references that we gathered for our research. Please feel free to use these and to utilize these articles to better adequate yourself with the ongoing struggles of ASD and how to better promote inclusion and progress for this. Thank you. That was Autism Awareness and Acceptance. Till next time.